High End Health on WSBT 22 is sponsored by Beacon Health System.
Well, you can sign up for the Sunburst races right now, and you know that money is helping children at Memorial Hospital. Thanks to funding from the Sunburst and the Beacon Health Foundation, there are now a team of therapists in the ER and ICU ready to help kids who struggle to understand the often scary world of medicine.
Yeah, child life specialists are trained to help children talk about and cope with having a family member who is hospitalized. WSBT 22's Kristen Bean shows us how this critical unit is expanding.
The tubes and the machines inside a hospital can be scary for anybody. But imagine seeing this through the eyes of a child.
My job is called Child Life Specialist, and I work with children.
Tracy Byler is part of a group of therapists with special training to help kids understand medical experiences.
Well, I've always been passionate about working with kids.
Byler connects with children inside the pediatric unit and the children of patients. She helps walk and talk them through what's often unfamiliar and scary.
The pressure garments that are on the legs, that's real common to see, and that looks confusing to kids.
She'll use pictures like this, stuffed animals or books to help children understand. Most of her job, though, is about listening.
I feel like you just really need to be honest with children, and you don't have to offer a lot of information. Just welcome their questions and allow them to ask anything they want, talk about anything they want to talk about, and be honest with them.
The Child Life Unit has recently expanded. Now therapists like Byler will also be in the ER, the surgical unit, and the adult ICU.
In childhood and probably for all of us, the uncertain is far harder than the certain to process. If we know what's going on, it's easier to deal with it.
Luke White is an ICU physician and helped expand the Child Life Unit. He knows firsthand how traumatic these types of situations are for kids.
I've got kids myself, and I have family who's been in this same ICU, in these same rooms. It was difficult to explain to my kids and explain to my nieces, my nephews, what was going on with the illness of somebody we loved deeply and were worried about. Even knowing everything I know, I wasn't equipped to do it.
Byler is equipped, and it's thanks to funding from the Beacon Health Foundation and community donors.
The Child Life program is something that is not covered by insurance. It's something that is an extra that we provide to children and families in our children's hospital, and is really only made possible because of the generosity of our community.
Byler's work will continue.
Well, it's very, very personal and very different for everyone.
Because whether you're a patient or not, health is for the whole family. In South Bend, Kristen Bean, WSBT 22 News.